Hello, my name is Mayank Pathak. I'm a physician at the Parkinson's and Movement Disorders Institute in Orange County, California. I'm going to be speaking to you today about a disorder known as spasmodic torticollis. Another name for spasmodic torticollis is cervical dystonia. Spasmodic torticollis is a neurological disorder in which the head and neck assume an involuntary, abnormal position and are difficult or impossible to bring back to neutral. Normally, the resting position of the head and neck has a neutral set point determined by the brain and the upper portions of the spinal cord. In torticollis, the set point for the resting position becomes changed, causing the head and neck to assume abnormal positions at rest. Abnormal signals from the brain cause an imbalance in the tone of the neck muscles. One or more muscles spasm and become overactive in their contraction, thus increasing their tone and pulling the head out of position. These abnormally contracting muscles will be referred to as the agonists. The exact direction and degree to which the head moves out of position depends on the particular combination of agonists muscles that are contracting in any individual. In some cases, muscles that correspond to the agonists but are located on the opposite side of the neck will begin contracting in an effort to move the head back to a neutral position. Such opposing muscles will be referred to as the antagonists. The tug of war that results between agonists and antagonists can produce a back and forth rocking motion of the head which resembles a tremor. The goals of torticollis treatment are to bring the head position back toward normal and to decrease pain, thereby increasing the patient's functional ability. The principles used to achieve these goals are as follows. Number 1, stretch, relax, and weaken the overactive agonist muscles. Number 2, strengthen the opposing antagonist muscles. Number 3, use adjunctive therapies as appropriate to manage pain. These can include medications, injections, and rehabilitation exercises. In this video, you will be shown techniques which can be performed at home with a minimum of equipment to accomplish these goals. The first step in therapy for spasmodic torticollis is to obtain an accurate diagnosis and evaluation of the condition by a doctor. A doctor can also determine which exercises are safe and appropriate for you to perform. We recommend that before attempting any of the exercises in this video, you obtain a thorough evaluation by a doctor experienced in the treatment of torticollis and permission to engage in stretching, range of motion, and strengthening exercises. Because different torticollis patients have different directions of head deviation and widely varying severity of their conditions, not all of the techniques shown in this video are appropriate for all individuals with torticollis. It is best to ask your doctor or physical therapist if a particular technique is safe and effective for you. All of the exercises shown in this video are to be performed slowly. You should perform all movements in slow motion. If any movement or exercise becomes unusually painful, you should stop and seek further advice from your doctor or physical therapist. We will begin by showing you some simple range of motion exercises or stretches.